So when should a patient be considered for a clinical trial? This is a great question. I think that every patient should at least be aware of what their clinical trial options are, probably from the beginning. We have trial options in the first line as well as second line and later options available. And it's important for patients to consider these options as part of their management and to be aware that clinical trials are often an option. When patients hear about clinical trials at the very end of their trajectory, and then there are few options available to them at that juncture, I think sometimes patients are quite disappointed that they didn't realize that a clinical trial was possible. I think travel and distance is a major issue for clinical trials. Patients with cancer might live in rural areas far from a clinical trial center, and being aware of what options are there is important, but taking into consideration quality of life is important as well. And I think a major thing that we need to focus on in the coming decade is how do we obtain access to trials closer to home so that patients don't have to travel as far. This is an important area of efforts for the future. Trials often have requirements that have to be met in order for you to be eligible, and looking for resistant disease and defining it is important. So some of the trials will have eligibility requirements where you have to have a confirmatory scan that shows that the disease is truly refractory or resistant, as opposed to having a late response. And because of that, it's often important to, in the setting of progression, to give that another cycle or two of immunotherapy. In the meantime, initiate a consultation so there's not any time lost is important. But putting in a consult and then waiting for a consult to occur a month later and no therapy in the interim is probably not, at least for the patients we're evaluating, is probably not necessary. I think you can continue therapy while they're being assessed.